The biggest problem that I had with my PTSD was I was walling myself off. I was dissociating from everything. I wasn't involved with anything. I couldn't engage. I was like a Muppet. I was just kind of doing my thing, but not living. It's like somebody else was in control.
Cognitive processing therapy looks at the assumptions people make about the world and themselves as a result of trauma, and looks at trying to challenge those assumptions to come up with more effective ways to see the world and interact with other folks. Typically, cognitive processing therapy is delivered over a course of about 10 to 14 weeks, where a person is seen weekly over that period. There's a new way of delivering cognitive processing therapy called accelerated or massed treatments. And in those treatments, veterans are seen multiple times per week, at least 3 times a week and up to 5 times per week over the course of about 2.5 to 3 weeks. They're able to complete a full course of treatment and get significant reduction in symptoms over that brief period of time.
We now have decades of research that shows that CPT works well for a wide range of people. That includes veterans and civilians across a wide range of demographic factors. It also works well across different trauma types. That includes combat trauma, sexual trauma, and other types of traumatic events as well. Most veterans seeking care in our clinic have experienced a wide range of traumas and a number of different traumatic events in their lifetime and are still finding significant benefit from CPT.
Coping with my PTSD before, what I was doing is I honestly was just shoving it down. Just, you know what, I'm not gonna do this. I'm not gonna worry about it. I got work, I got family, I got friends. This is good enough. And it wasn't good enough. I mean, slowly but surely I was falling apart.
Our ultimate goal in CPT is to teach veterans to be their own therapist. That way they're able to maintain the benefits they get from treatment long after they're done meeting with us. That means being able to feel in control of their thoughts, their emotions, and being more at peace with their trauma.
Instead of going from week to week, you're going on a daily basis. One of the benefits is you don't have the opportunity to fall into or back into daily life.
But since we were meeting so frequently, it was only a matter of days before he was able to start using these tools, the skills that we're learning in CPT, to start addressing his problems, start processing through his trauma. And really, through using those strategies, you could also see him becoming much more comfortable in the session, starting to smile more, laugh, we would joke. And it was clear that those benefits were really starting to spread through all different areas of his life.
As I've continued to use the process, it is changing the way I think, and it is affecting my entire outlook. I'm less negative. I'm actually enjoying things a lot more. I'm looking forward to things a lot more. Whereas before I was always looking at the negative aspects. Now I'm looking at, all right, this sounds cool, let's do this.
Accelerated CPT can be delivered in several ways in a traditional face-to-face office setting, but more innovative is delivering CPT, accelerated CPT, through telehealth. And that's one of the things within the VA we've put a lot of effort into. So veterans can be seen really across the catchment area or in rural areas far away from a medical center, and they can get the same effective treatment over telehealth. A veteran dials in for a video session with audio and video on their computer or device, a telephone, in a private space, and they are connected directly with their therapist.
In the veteran community, there's a big stigma with mental health. It's like, oh, did you hear about Steve? Or, did you hear about Bob? And so I was very nervous and leery about it going into it because man, what are the guys that I know going to think about this? What are they going to think about me? The best thing I could say is, who cares? You're in it for you, not for them. My daughter has noticed the biggest change for me, and she's actually said, you're a different person. You're a better person again. My ex-wife and I were actually beginning to have a relationship as friends again. Before, we didn't talk. My friends and coworkers, they notice that I'm happy again, that I'm enjoying myself again, instead of closed off, instead of walled off.